previous video, we saw the signs and symptoms of Ebola as loss of appetite, sore throat, the fevers, the bleeding from all the body, openings on the body, the fatigue. So let's see how this Ebola virus, how can someone get this Ebola virus? Most of the times we get this virus from the people who are already infected. So these are the ways how someone can get that, how it spreads from one person to the other. So let's begin on the spread. One, when someone gets into contact with the infected animals, more so the wild animals or the bush meat, when someone eats the bush meat. So we saw very well that it can be got from the wild animals like the monkeys. Uh, they are the key habitants for this virus. So when someone gets into contact with the wild animals like that, if someone gets to or eats the bush meat that is already infected, someone can get the Ebola virus. When someone gets into contact or touches the stool, the feces, or the urine from an infected person or a person that is suffering from Ebola disease, you are standing yourself a chance of also getting infected to this virus or this disease that is called Ebola. Then when someone gets into contact or touch the vomits, when someone vomits, because we saw that also vomiting, it's a key sign of this Ebola virus. So when someone gets into contact with the vomiters or the vomits from an infected person with Ebola, you stand a chance of getting this Ebola disease or Ebola virus. Then when someone gets into contact with the beddings, assuming someone slept in that bed, someone had Ebola virus, and then you happen to go in those beddings, you're also at risk of getting this Ebola disease. Then open wounds. We saw very that spreads also through the blood. So the open wounds on the body, when someone has an open wound on the body, we know very well that there is a virus, and any broken skin on your body can be a source of, can be an entrant for that virus or the bacteria. So when someone has open wounds on the hands, on the body, you stand high chances or you become at risk of getting the Ebola disease. Then we also have when you come into contact with the food, the utensils that a person with Ebola has used. So you also stand a chance of getting this viral infection, since mostly it comes into contact. So the person who was affected with Ebola ate something and left over some food. Someone used a cup, someone used a plate, and then you happen to also use the same. You're also standing a chance of getting this Ebola disease. Then when you eat the uncooked vegetables or when you eat the fruits that are not washed, you also stand a chance. You can also get in touch with this Ebola virus. So we should also be keen with the fruits that we eat, with the vegetables, because when you don't wash them very well, you don't peel them before eating, you can also get into contact with this person with this Ebola virus. Then when you get into contact with the blood from this Ebola person, you get into contact with that person, you are also standing a chance of getting this Ebola disease. Then having sexual intercourse with an Ebola infected person. When you have the sexual intercourse with this person who has encountered with the Ebola disease or the Ebola virus, you also stand a chance of getting this Ebola virus, this Ebola disease. So in case you are in a relationship and then the suspect that the person you had Ebola virus, you also become a suspect, because we know very that when you have sexual intercourse with an infected person of Ebola, you also stand the chances of getting this Ebola virus. Then also the clothes, when you come into contact with the clothes of this person, and then when someone has died, those people who get in touch with burying the dead body. So when you get into contact with burying these dead bodies, people who have died with Ebola virus, you stand chances of also getting this virus. So whenever we suspect that maybe this person has died of Ebola, we should always be keen and inform the authorities about, and then they arrange how to bury this person, because when you encounter yourself, you're also putting yourself at risk of getting this Ebola virus. So that, with knowing all that, we should always be protective of our souls. We should always guard our souls. We should always keep a watch on everyone, on every person we treat. Then this goes to the health workers. Let us be keen on our patients. Let us watch the signs and symptoms